Welcome to AWHONN Insights, the home for candid nursing conversations. Today, we're discussing advocacy for alleviating diaper need and period poverty in the U.S. We're delighted to welcome two leaders who are passionate about human rights, health equity, and social justice. Lacey Gero, Director of Government Affairs at the National Diaper Bank Network, and Dr. Tabitha Poole, Director of Women's Services at a Central Texas hospital and clinical instructor for obstetrics in the BSN program. I am Bria Anokise, your host, and I'm joined by co-host Shannon Francois, a clinical nurse educator and labor and delivery nurse. Before we jump in, please note on your calendars that National Diaper Need Awareness Week is September 23rd through 29th, and AWHONN thanks Huggies brand for their ongoing support of the Healthy Mom and Baby Diaper Drive. Shannon, the podcast is all yours now.
Thank you, Bria. Hi, ladies. How are you doing?
Hi, good.
Welcome
for having us.
Yeah. I'm excited about this topic because it is somewhat new to me, but very, very interesting. I loved reading about the National Diaper Awareness Week and Period Poverty Awareness Week. I think those are amazing, things that we have nationally that provide, a little bit of education on this topic, because I think a lot of people don't know that this is an issue. So can you, Lacey, tell me just a little bit about the National Diaper Bank and the period poverty groups that you are part of?
Yeah, absolutely. So the National Diaper Bank Network leads a nationwide movement dedicated to helping individuals, children, and families access the basic necessities they require to thrive and reach their full potential. That includes clean, dry diapers, period supplies, and other items like incontinence products. NDBN exists because there's 1 in 2 U.S. families that struggle to afford diapers. And NDBN is dedicated to creating awareness, providing assistance, and building community to end diaper need. We work with more than 300 basic needs banks across the country in all 50 states, DC, and Puerto Rico. And we have a program within our organization called the Alliance for Period Supplies. So it's a program of the National Diaper Bank Network that focuses specifically on period poverty because 2 in 5 people who menstruate have struggled to afford period products in the U.S. So we work with the individual nonprofits that collect, warehouse, and distribute either diapers or period supplies, sometimes both products. And they're working in their local communities to make sure that diaper need and period poverty no longer exist in their local communities.
I loved reading on your Instagram for the National Diaper Bank Network and period poverty about the statistics, because it's alarming. I mean, the amount of women who have had to miss work or school because they didn't have personal hygiene products, the amount of parents who have had to miss work because their children didn't have these basic needs. And they are really basic needs. I know this is a global issue, but specifically here in a first world country, we have this issue. So now, basic needs informed care is something that I'm also just learning about. And I find this very, very interesting because, again, it's something that maybe to a lot of us is just comes normal and natural and something we don't even think about. But as I've seen now with these statistics, a lot of people in this country, it's something they are constantly thinking about because they don't have the needs, they don't have their basic needs being met. Tabitha, can you tell me a little bit about basic needs informed care and how nurses might be able to apply these concepts to their practice?
Yeah, absolutely. I admittedly this didn't even come on my radar until a few years ago. And I'm embarrassed to say that. Like, I never considered that. And I consider myself to be very in tune and very much an advocate for human rights and, just basic equity in all aspects of life. So, first of all, I think it's important that we share with one another and we make sure that we are aware of this as a needs assessment for all of our patients coming in. We serve patients from all walks of lives, and it's something we should be screening for if they have the ability to meet these basic needs. So I think education of ourselves, first of all, but then of our patients. And also discussing this topic with our patients as a basic human need and trying to help eliminate some of the stigma that comes around discussions about menstruation, because I think that's a barrier just as much as access. It starts with being able to speak about this as a basic need. So I think that is part of it, screening, educating, and also we have the ability to ensure they at least have adequate supply when they're leaving our care. And then we share so many resources with our patients, and this is something we should be adding. This is a resource that we should be providing to all of our patients, in addition to all of the other things that we routinely do.
So you talked about the stigma related to, period supplies, menstruation in general. This question is for both of you. Tell me a little bit about, have you experienced this stigma in your field, in your practice, and what does that look like? I mean, bringing it up, either one, the diaper needs or the personal hygiene needs, is it, is there a cultural aspect to it? Is it is there a generational aspect? What have you seen or heard?
Well, I can speak a little bit on both the diaper and period poverty side of things. With diapers, I think there's the stress and anxiety that comes with not being able to provide for your children. And so we're seeing that diaper need is tied to maternal mental health, and it definitely comes with a lot of stress and anxiety. So I think it's hard for a lot of mothers to have that conversation of, I'm experiencing diaper need, because for moms, that means, they're not providing when it's not, necessarily their fault. Right. And so I think there's just that level of almost embarrassment when it comes to not being able to provide for your children. And then on period poverty, there's definitely a lot of stigma, especially, in speaking with men. My job, I work with a lot of policymakers. And so having that conversation of, one, period poverty exists in the US is often a new concept for many people, no matter what gender. But when you're talking with men about periods, there is just a level of stigma and lack of understanding that you have to break through. But one thing I have seen, and I feel is a great thing that's happening, is that certainly with men that have daughters and are married, there's just this understanding of like, yes, I've gone and I've bought period products for my wife before or my daughter before. And so I think you just have to put it into that perspective and try to break that stigma down. But again, period poverty also comes with a layer of embarrassment to not be able to provide period products for yourself, and oftentimes having to use proxy items to get through the day. It's a natural, unfortunate part of period poverty. But Tabitha, I'd love to hear how you've seen this in your work.
Yeah, I think I absolutely agree about the perception of inability to care for your children when there is a diaper access concern. But I think as mothers, we also are very much taught and intuitively put our children above ourselves. And even as a society, I think we have way more programs that support diaper access than we do period product or menstrual product access. And I think that's just all feeding into the stigmas that you spoke to. And also, historically, periods and all aspects of menstruation have kind of gotten perceived, or the stigma of like dirty, or something that is taboo, and that we want to hide, or and just the fact that it's a normal, unavoidable process that almost all women are going to experience, and often for decades. It's just really important that we get past that. I do think there's some cultural aspects. Different cultures approach this different age groups, but it's kind of universal as far as that perception of it's the unspoken. And again, women are naturally going to put their children first. So if it comes to diapers versus menstrual products, diapers are where it's going to be, right? And so then they do end up in all of the trickle effect of that lack of access.
I actually recently saw that a celebrity, Jessica Biel, wrote a children's book about periods. And I thought that was really interesting, maybe controversial, but also very interesting that, we need to talk to our daughters about these things. And what better way than, introducing it in a way that they could better understand. So I thought that was a great way to open up that conversation. And being a mother myself, I totally understand, what you guys are talking about with the embarrassment of not being able to provide for your children, because mom guilt is a real thing. And so that is a difficult, aspect to wrestle with if you are in need. Now, you talked a little bit, Lacey, about legislation, and, working with government representatives to kind of try and get changes made. How can nurses get involved with that aspect, the legislative and getting changes made? How can they get involved on that level?
Yeah, well, I think one of the things that anybody in this space currently knows is that it's going to take a lot of us to really make a true change. And I think those that are in healthcare have a very unique perspective on the issue that really, I think policymakers will listen to and hear. So we welcome anyone who wants to get involved in this work to come, speak to politicians and really to work to make a change. So in terms of advocacy, we advocate throughout the year for policy changes, whether it be funding for nonprofits that are working to make a change, or exempting diapers and period supplies from sales tax. We're constantly working to make these small changes that we know are going to make a big difference. And what we know is that in addition to the work that's happening on the ground with the local nonprofits, government investment is truly needed to really, put an end to period poverty and diaper need. So we have opportunities throughout the year to get involved with advocacy. This week that this podcast is airing is National Diaper Need Awareness Week. And so throughout the year, there's two sort of big opportunities to get involved with period poverty and diaper need. And so Diaper Need Awareness Week is the first. And during this week, even if you just post on social media, the goal is to raise awareness for the issue. We know that there are still people that don't even know that diaper need exists, despite that maybe their neighbor is experiencing it. And so if you can post on social media, volunteer at a local organization, or even write your elected official to say, hey, please consider making a change in our state to ensure that diapers are tax exempt, or that there's support for families that are struggling with diaper need. And then during May, which is Menstrual Hygiene Month, there's a week called Period Poverty Awareness Week. And so in 2025, that's going to be the second week of May. And so that's another opportunity to get involved with either, through social media, or even going to your state capitol and talking with your elected official, giving them a call. There's just what we want to do during these weeks is really raise awareness from all across the board. And then throughout the year, if there's coalitions that that nurses want to get involved with, we work with coalitions throughout the country that are working to make policy changes. And so if there's nurses that are interested in getting involved with that work, we're happy to connect them.
Lacey, can I share just one sort of like tangential topic that you brought to mind? I believe it was in 2020, right during the height of COVID, where if you had medical flexible spending dollars, the rules changed, and you were able to then purchase period products and be reimbursed for them with that flexible spending. I don't recall that before the year 2020.
Yeah, that was a federal change in 2020 under the CARES Act. And so basically it changed the definition, the IRS definition of menstrual supplies to be a medical term. And so what happened is that anybody who has that flexible spending account, a health savings account, could actually go to the store, use your flexible spending account or health savings account to purchase period supplies, or you can be reimbursed for it. So that still exists. So if you have one of those accounts, I use mine to get period products all the time, which has been really great. And I think it's really a step in the right direction in terms of seeing period supplies as medical devices, as something that can really help overall health.
I agree. Thank you.
And Tabitha, I know you're really involved as well in advocacy. Do you have any recommendations for nurses on how they can get involved either on the local level or through AWHONN? I know you're part of the Accountability, Belonging, and Culture Committee. Have you seen a lot of opportunities for that with the work that you're doing?
Yeah, I think specifically being in women's health, I think we have a very close-knit across the nation specialty where we're all interlinked. And I know that I co-lead our local AWHONN chapter, and we did a drive, a period poverty drive here a couple months ago. And the vast majority of people, even within our chapter, were not aware of this need, right? Because they're not personally impacted and it's not something that is widely discussed yet. So spreading the need, but as we grew in our local community, we had a very successful drive because not only were the nurses at the core of this that were leading the drive not aware, but then they're sharing on social media and we're sharing in our hospitals and in our communities. And so many people were like, oh my gosh, I didn't realize there was this need. I want to help. So I think just spreading that knowledge out there, and there's a lot of people who just aren't aware. And like I said, a few years ago, I was one of those people. And that's embarrassing to say that I just hadn't considered that this was such a barrier for so many women. But also within AWHONN is a phenomenal organization with a lot of outreach opportunity. And, one thing that we do every year is AWHONN on the Hill, where we go and lobby for things specific to our patient population and the needs. And so this is something that we could consider taking advantage of in that opportunity. Here locally in Texas, the TNA, the Texas Nurses Association, has a lobbying day for local legislation. So that is also something, an opportunity as nurses that we can take advantage of. I know in almost all women's service lines, we work very closely with our emergency service line, and they are also a port entry for patients. They see patients from a wide spectrum of needs and backgrounds and so on. And so I think just spreading that awareness and helping to grow our knowledge, our ability to intervene, our ability to support is where we start.
Get a group of nurses behind something. We're a force. So I wholeheartedly agree with that. And tell me a little bit about the SBAR that you wrote based on the basic needs informed care.
Yeah, so I was really grateful that I was presented with that opportunity because as I continue to mention, like I didn't know. And so that just makes me think, how many other people don't know? So It was an opportunity for me to share what I've learned and put it in a formal format that could then reach lots of other people. because I think that there will be a lot of light bulb moments for people, which will then lead to a lot more engagement in correcting this nationwide concern. But I think we start with awareness. And so that was the SBAR. And essentially, it was just a recap of this need exists. Here's the impact on our community for women who don't have access to these products. And here's what we need to do to support it.
Right. Nurse leaders, we need nurse leaders like you. And I think it, like you said, it starts with awareness. It starts with, something that you feel passionate about, and just bringing it to the forefront. I love that you brought up the Day on the Hill. That's something that really any nurse could get behind, and show up and do the work that we need to be done. I know that Lacey, on the Instagram, when I was looking at all the different statistics, and social media is such an amazing tool. Tabitha, you talked about your nurses sharing on social media, and Lacey, you talked about people sharing during those awareness weeks. It really is such an amazing tool that we have now to let millions of people know about these things. But Lacey, one of the things I saw is that a lot of states, maybe not a lot, some states are really jumping on this. And like New Jersey has the pilot program for basic needs like diapers and period products. I am drawing a blank as to which state it was, but they had tax incentives for people to donate to the National Diaper Bank and other organizations. So I think that's really a great step in the right direction. And it brings up another thing that people have different thoughts on, and that is we have government programs like SNAP and like WIC, and adding those basic need products to those programs. And for both of you, what are your thoughts on that?
Well, I can speak to the National Diaper Bank Network and the Alliance for Period Supplies. We actually don't support adding period products or diapers to SNAP and WIC, specifically because SNAP and WIC are food-based nutrition programs.
Mm-hmm.
And unfortunately, the programs have been historically underfunded. And so we have seen that there have been efforts to try to add the products in some states to these programs. But what has happened is that if the products are added, there's no additional funding being allocated to actually fund those products. And so what happens is we're forcing families to make a really hard choice between, do I buy food or do I buy period supplies or diapers with this very small amount of money? And right now, in the political climate that we're in, both systems are oftentimes on the chopping block, and we're just not going to see that additional money being added to the program. So we don't want to force people living in poverty to make even more difficult choices with the limited money given the program. But that's why you see, so in New Jersey, what you mentioned, Shannon, there's a pilot program through TANF, which is Temporary Assistance for Needy Families. And in New Jersey, they call that program their New Jersey Work First program. And that program in New Jersey is interesting because it's actually not just for families. They have a program for individuals as well. And so what they're piloting is providing families with a direct stipend. It's not connected to any of the food programs, but it's just a stipend specifically for diapers or period supplies. And we've seen in Washington State, they actually provide families that are enrolled in Temporary Assistance for Needy Families $100 a month to purchase diapers. And a similar policy was passed in California. One of the challenges with TANF is it's very limited in who's actually eligible for that program, and it's temporary in nature. So it will only help a family for a certain amount of time. And so I know one of the other things that we've been looking at is Medicaid coverage for diapers, which actually successfully, the first 2 states are undergoing programs for Medicaid coverage of diapers. So that's in Tennessee and in Delaware, which is really exciting because we know that these without diapers, children might have increased risk of diaper dermatitis, and then mothers might have that stress and anxiety we talked about. And so same thing on the period supply side. We're constantly looking at ways to cover period supplies through insurance and through Medicaid. And there was the first bill introduced on that in California this year that didn't pass, but we won't give up working on it.
Right.
So I have a slightly different perspective on that. With all respect for the perspective that Lacey shared, absolutely is logical and makes sense. I guess expand further on that with the recognition that someone who's qualifying for SNAP and WIC is obviously qualifying for a reason due to their financial struggles. And so recognizing that diapers and period supplies are a basic need, there should be some inclusion. And I not to take away from their access to food, because clearly that is a absolute need without debate. But recognizing that if we can't adequately feed our family, then we most likely also can't diaper them and have menstrual supplies. So I think there should be, Lacey spoke to Medicaid. A lot of individuals who qualify for SNAP would also qualify for Medicaid. I know a lot of states have expanded nationwide. We've expanded our postpartum coverage. So there's some steps in the right direction, but I think this is a medical need. She spoke earlier about the FSA and HSA programs now recognizing that as a qualified medical expense. And I think that we should be pursuing that to be covered by insurances, not even just Medicaid, but universally, because it is a qualified medical expense. And if we're saying it is for HSA and FSA, it makes you, have to look further into why isn't it for insurance coverage. Some other things that could offset that is, there are, I think, a little more than 10 states that have free products available in schools. So there's another way that we can expand across that, right? And alleviate some of that need from SNAP and WIC programs where maybe it's not as appropriate, but recognizing that there is a trickle effect to that financial struggle. And this is an absolute human need. So federal prisons are now, there is products supplied in federal prisons, but not state and county. Right. So there is some opportunity there because, again, how are these individuals supposed to meet this basic need? And then that puts the burden on the family who often have additional financial struggles statistically. So I think there's just so much trickle effect, and it all kind of starts in my brain with if we're qualifying for these programs to help meet other basic needs, we have to look at the bigger picture.
And I love that it's becoming more of a conversation. And like you said, the education and awareness, and that more states are jumping on with these programs and recognizing it as a need. And that, the sales tax, they're removing the sales tax from these products as well. That's another, big conversation. And what can we do? What can we do as nurses? What do we need to write letters? Do we need to, what is it going to take? Chip in, either one.
Well, Tabitha, I'm curious if you worked on the sales tax legislation in Texas, because that was a huge success for the country, that Texas actually exempted period supplies and diapers from sales tax last year.
Wow.
Yeah, I cannot claim any ownership of that success, but I'm super grateful for it. It's one place I think, unfortunately, Texas is sometimes behind the power curve in a lot of these issues. And so I'm grateful that we were at least able to pass that and have that sales tax removed. I do feel like that is the tip of the iceberg, but it's progress. And baby steps are how we get where we're going a lot of times. So definitely celebrating that success. But I think we have to keep moving, right? The sales tax impact is impactful, but minimally when I still am paying the high price for these products that I don't have a choice to purchase.
And that's what, one of the things that I've seen across the country is typically in the states that do pass a sales tax exemption, it's like an entree into the issue. Once they hear about that, then they're like, oh, yeah, there's more going on here. And so then they talk about what Tabitha mentioned, period products in schools and even period products in public buildings. And so it really opens this door. And I think the tax is really important as a messaging point to say that period supplies and diapers are not luxury goods. They shouldn't be taxed at the same rate as handbags or makeup or other luxury goods. These are basic necessities. And so why are we taxing them? And, in many states, food isn't taxed, but we'll tax period supplies and diapers. And so one, it's an important step in recognizing that these are basic necessities, but just like Tabitha mentioned, it's just the beginning of what needs to be done to truly address the issues.
And just another little, announcement to all of our listeners of why we need support and why this is so important. And any of our listeners that have children or menstruate would understand this, and I'm sure I would hope get behind it as it's such an important issue. And Tabitha, I had mentioned earlier that you're part of the Accountability, Belonging, and Culture Committee with AWHONN. I wanted to know a little bit more about what you all are doing within that committee.
Yeah, so the ABC committee, as we call it, is formerly known as DEI, right? The name was changed to kind of get away from that negative stigma that has in some places, what been applied to the DEI term. So it's all about just equity across the board and recognizing the needs, sharing the needs of marginalized communities, which would include those who are living in, lower income brackets, more socioeconomic needs, et cetera. So that's what the ABC committee is all about. It's about supporting AWHONN's initiatives to include all of these other aspects of other cultures and belonging as AWHONN moves. So that's our purpose, is to really offer feedback, offer suggestions, recommendations to other aspects of AWHONN and initiatives to keep that at the forefront as we make decisions, make materials and presentations and all of those things. So I'm really grateful that it exists and that I get to participate. But in regards to diaper drive, AWHONN always is doing the Every Mom, Every Baby, lots and lots of work being done there. And obviously the ABC committee is fully in support of that. So just, again, spreading awareness, taking into account communities that are often forgotten in mainstream decision-making and projects. And so that's really what it's about.
I love that. And another way for everyone to get involved. There's so many opportunities through AWHONN, and even, through Lacey, with the National Diaper Bank and period poverty awareness. I'm sure there are ways that nurses can get involved with those organizations in their local area. Like, how could if, let's say, a group of nurses wanted to bring the National Diaper Bank to their area, or, start some type of drive or something in their local area, is that something that they could reach out to you for support with?
Yeah, thank you for bringing that up. And I just want to first say thank you to AWHONN, because I know that, every time that you all meet annually, there is a drive for a local organization, and that has brought diapers to so many communities. So thank you for all that you all have done to support that and for continuing to do that. For those that want to get involved or be connected with your local diaper bank, basic needs bank, or period supply bank, like I said at the beginning, there's more than 300 across the country. So there might be one in your local community that you can get involved with. We, on our website on the National Diaper Bank Network.org, have a member directory for diaper banks. And then on our Alliance for Period Supplies website, which is allianceforperiodsupplies.org, you can find a member directory for period supply banks. We also have a toolkit about hosting diaper drives and period supply drives. And so if that's something that you want to do, but you just don't know where to start, those resources are available on our website. And certainly if somebody is really passionate and they even want to start their own program or diaper bank, period supply bank, we have information on our website as well, or you can always reach out to the National Diaper Bank Network and we'll be happy to direct you. But we really appreciate all the support of nurses because we know that many nurses have volunteered and have done drives and even run programs across the country. So we really appreciate your efforts.
Those are great resources, and thank you. I hope that this will, empower people to, get involved and start, bring this conversation to the forefront, and be a part of the change. So that's really exciting. I also I believe it was on the National Diaper Bank Instagram. You guys you have a great social media person, by the way.
Y'all let them know.
I did also see there was a post about basic needs informed care curriculum. So I thought that was very interesting. I would love to actually register and take that myself because, the basic needs informed care was fairly new to me. So I would love to learn more about that and how I can bring it into my practice. Can you share anything on that?
Sure. Yes. It's not my area of expertise, to be honest, but it is an incredible offering. So regularly throughout the year, our CEO, Joanne Samuel Goldblum, and her co-author of a book that they wrote, Broke in America, they host this curriculum, and it is a great opportunity to learn how you can practice basic needs informed curriculum and care. And so they host that regularly. I don't know the exact rate, but all the information is on our website and it's open to anybody who's interested in learning. And you'll also get a copy of that book that I mentioned when you register. It will be sent to your house. And so certainly look out for those opportunities. It's also available on Eventbrite. So if you look up basic needs informed curriculum, you'll find a link to our next opportunity.
I think it's in September because I'm definitely going to go sign up. So thank you. And so thank you, ladies, both for joining us today and having this conversation and just, bringing awareness to it and talking about some of the issues. And I hope I know you two will continue your important work. And I plan to get involved myself and bring the conversation to my area. And I hope our listeners will do the same. So thank you so much.
Thank you. Thank you for the opportunity.
Thank you so much to you both. I was listening to those statistics, and I believe, Lacey, you said 1 in 2 families can't provide diapers for their babies, and 2 in 5 people who menstruate can't afford their period products. So that means we're all tied to multiple people in our lives that we can support and we can advocate for, right? I encourage all of our healthcare professionals that are listening in to take stock of where you stand on the issues. Think broadly about how you can bring forth change, reduce the stigma for people and for families in your local community. You can host the drive, and Lacey gave you all the information on how to do that. You can donate to local diaper banks, or you might end up at the steps of your very own state house. So I personally think that we have the solutions to these multiple issues. Thank you to all of our listeners for the privilege of your time today. We ask that if you learned something new from this episode, that you share it with a colleague or with a friend. You can find us at awhon.org/podcast with an S. And you can read Lacey and Tabitha's full bios. You can review all of the resources that they shared with us today. For sure, you can follow them on social media and on LinkedIn. AWHONN Insights is available wherever you stream your favorite podcasts. You can watch us on YouTube. And please leave us a review of the experience that you're having. Once again, National Diaper Bank Need Awareness Week is September 23rd through the 29th, and AWHONN gives special thanks to Huggies brand for their ongoing support of our Healthy Mom and Baby Diaper Drive. Thank you all again so much. Be well and stay safe.